We know that the government is planning to make some big announcements this week, lifting almost all or potentially even all of the COVID restrictions. The public seems to be quite uneasy about this. As I was saying to Tom a little bit earlier, the latest polls say that 75%, according to a YouGov poll, of people don't think that the self-isolation should be lifted, that if you do get a positive COVID test, you should be legally duty-bound to stay at home until you're negative. But that is certainly one of the restrictions we're led to believe will be lifted, as well as mandatory face masks, mandatory social distancing, and potentially free tests, both lateral flow and PCR tests. That might be coming to an end. And as some of the papers have been saying today, that will put a very significant financial burden on people who feel they must regularly test, either for their own safety or for the people that they see, maybe vulnerable people or people who they work with. So there's a lot to digest in these new announcements. I'm delighted to chew it over with me. I'm able to talk now to Labour's Shadow Health Secretary, Wes Streeting. Good morning to you, Wes.
Good morning.
Let's go straight in with these restrictions, with COVID restrictions. Is the government right now to lift restrictions, potentially from the end of this week?
Well, there doesn't seem to be a great deal of support for ending free testing. And that seems to me to be a bit like taking your best defender off the pitch when you're 2-1 up and you've got 10 minutes left of play. We're not out of the woods yet on COVID. There is real unease about removing access to testing because that's how people make informed decisions to do the right thing, not just by themselves, but by loved ones, co-workers, friends. So that seems to me to be a pretty self-defeating thing to do. And then I was really struck listening to your bulletins there, because a lot of the headlines today are about the removal of the legal requirement to self-isolate. Again, you won't find many, if any, NHS and scientific leaders supporting that either. But what Boris Johnson seems to be saying is we're going to remove the legal requirement to isolate at home, but there'll be guidance suggesting that you do. And by the way, I'm removing access to free testing. So it just seems a bit of a mess, to be honest. And one of the things we've learned throughout the pandemic is the importance of clarity, clear messages, clear communication so that people can do the right thing. And so it's pretty confusing, to be honest, to hear, on one hand, Boris Johnson wanting to declare victory, say, the legal requirement to isolate is over. That's dominating the headlines, sending a message to people that isolation is no longer important. But at the same time saying the guidance is going to still ask people to isolate and do the right thing.
But Wes Streeting,
so
as James Cleverly was just saying to Tom, that's what you do when you have flu. There's no legal requirement for you to stay home. But if you're a decent person who doesn't want to spread your germs around other people, you just do it anyway. And it's putting that sense of responsibility back into the individual rather than the nanny state telling them how to behave.
Well, I think Boris Johnson is trying to declare victory before the war is over. And that's because he wants headlines to be about, victory over COVID rather than police knocking on the door of number 10 or some of the revelations in today's Sunday Times about dodgy donors and influence over the Conservative Party and its policies. It seems to be more about political priorities rather than public health interests. And that's not the right way to behave. And look, Boris Johnson's got 24 hours before he comes before the House of Commons tomorrow to make a statement. So in that time, it would be good if the government could point to any leading figure in the NHS or the scientific community who thinks that this is the right thing to do and the right time to do it.
But of course, as the government would say, and James Cleverly did pretty much say it to us when we put to him Professor Nabarro's point about this seems like a gamble, he sort of said, well, that's what the medical community would say because they're only concerned with one side of the story, whereas politicians like yourself, like the government, have to look at all sides and they have to work out what's affordable and they have to work out the knock-on effects of these policies to other areas, either the mental health side, the children's education side, the economy. And those things do matter. And just going back to your football analogy that you started off with, if you can't afford that striker or that footballer, then you can't use him. And that's that has to be a part of the planning on this. The Treasury is saying all these free tests are incredibly expensive and not all of them are necessary.
Well, two things. Firstly, we do need to look at these issues in the round, and it has been striking this week to see business voices like the CBI cautioning against removing free testing, school leaders like Reverend Steve Chalk, who was founder of the Oasis Academies Trust, worrying about the loss of access to free testing on disruption to learning, which has really suffered during the pandemic. So I think there are a wide range of interests here saying, look, don't scrap free testing. This is still really important. People should isolate at home if they have the virus. And as to cost, well, since the start of the pandemic, free lateral flow testing has cost £6 billion. Now, of course, it can't go on forever, but how about we try and recoup a fraction of that £4 billion the government has given away in fraudulent COVID loans? Let's get our money back and use that money to continue to fund free testing, and let's review that situation before the summer. Because, of course, we can't go on forever with free testing. No one's suggesting that we should. But I don't think this is the right decision at the right time. And that seems to be the chorus of opinion we're hearing from NHS leaders, scientific minds, business leaders, school leaders.
Well, if now isn't the right time, when would be the right time? Because deaths are down, cases are down, hospitalisations are down. What would it take for you if you were the Secretary of State rather than the Shadow Secretary of State? When would you lift restrictions?
So I think it would be a sensible thing to have periodic reviews. Let's review the situation before the summer, and let's get to a point where you've got that consensus of opinion, both in terms of the NHS and the scientific community and right across business and education and so on. But in our plan for living well with COVID, which we published in January, we pointed to a whole range of things the government could and should do that don't impact on people's lives or livelihoods or liberties, that would help us to exit the pandemic safely and also protect us against future risks of new variants, whether that's fixing sick pay or having a standing jabs army of volunteers ready to help with vaccine rollouts, or indeed showing greater international leadership to reduce the risk of new variants by ensuring we're vaccinating the world. And there have been some encouraging steps this week in terms of talks between the European Union and the African Union on things like patent waivers. But I think there's a lot more for the international community to do, and the UK should play a leading role in that too.
I am going to move on in just a minute to other subjects. But just before I do, there was a story in one of the papers today about NHS trusts spending more than £46,000 on painting rainbow pedestrian crossings at hospitals to promote diversity. Now, some of those trusts cited a Stonewall report which said 1 in 7 LGBT people avoid healthcare for fear of discrimination because of their sexuality. I just wonder if you approve of these rainbow crossings and think that is the answer.
Well, I think the NHS has made great steps to improve access to services for a whole range of underrepresented communities who often don't seek access to healthcare. And I think there are a whole number of things that to be done, both to build patient confidence in the NHS, but also to build staff awareness.
But painting rainbow pedestrian crossings?
Well, look, I've been pretty clear with the NHS already, and I'll be saying more on this later this year. The NHS budget does take up a significant proportion of government spending, and we will expect the NHS to make sure every penny of that is well spent. And if the business case can be made and justified, then fine. But I think there's a serious point here, which is about making sure that the things that we are doing to make sure the NHS is accessible and inclusive and understanding of a whole range of diverse communities, to make sure they get that right, but do so in the right way, which is about more than gestures. I think it's about the substance of inclusive healthcare.
Wes Streeting, let me ask you about possibly the worst kept secret in Westminster, which is the suggestion that there's going to be a pact, a non-official pact between the Labour Party and Lib Dems, where you won't fight some of the seats where they're in second place to the Tories, and they won't fight seats where perhaps you're hoping to win back some of those red wall seats.
It has always ever been thus, that there are some seats in the country where the Liberal Democrats are better placed to beat the Conservatives, and there are many more seats where Labour is better placed. What I can tell you is there have been no talks, formal or informal, between our two parties. There will be no pacts. What you will see, I suspect, I can certainly guarantee from Labour's perspective, but I suspect is also true of the Liberal Democrats, is we will be ruthlessly targeting our resources on those seats we need to win from the Conservatives in order to form a government at the next election. And that's about making sure we've got the right ground campaign in the right seats, but also making sure we've got the right policies to inspire voters that Labour can be trusted. And on that latter point, the enormous strides we've seen under Keir Starmer's leadership to regain the trust of the public have been really significant, have put Labour back on track to be a party of government. But the one thing I do want to leave you with, and Keir would say if he was doing this interview, we are not complacent one bit. We know there's still much more work to do to win back the trust of the voters, and we're determined to do it.
Wes Streeting, Shadow Health Secretary, many thanks for joining us on Times Radio.